Hi there, I'm Lynn Ngai, future anesthesiologist here with the Stanford AIM Lab at the 2015 Sol Shnider conference in San Francisco. I'm here with Dr. Barbara Scavone, professor of anesthesiology, critical care, and obstetrics and gynecology at the University of Chicago. She's also the chair of the planning committee for this year's conference. Dr. Scavone, it's such a pleasure to talk to you today.
Thank you. It's a pleasure to be here.
Do you think that this conference is solely for obstetric anesthesiologists, or are other anesthesiologists and practitioners also welcome?
Quite the contrary. I think it can be useful for people who do mostly or all obstetrics, but it can also be even more useful for the anesthesiologist who does occasional obstetrics, who takes obstetrics call. Those people might have more difficulty keeping up with clinical trends because they don't do exclusively OB, and so they can actually benefit more from a very clinically relevant conference such as ours.
Is this your first time planning the conference, or have you been involved in the past?
I've been on the committee before. This is the first year that I actually chaired the committee.
You also gave a talk on labor anesthesia in the obese patient. Could you give us a few takeaways from that?
I think one of the biggest takeaways is that obesity is becoming more prevalent. It probably has not leveled out in the United States yet. It puts patients at increased risk. And it takes multidisciplinary collaboration with your obstetric and nursing colleagues to take care of these patients safely. Probably the biggest thing the anesthesiologist can do is to see these patients as soon as they get to their floor, encourage early neuraxial analgesia because these patients are at high risk for ending up in the operating room even when they're on the labor floor laboring.
Do you have your own guidelines as to how long you generally like to keep your obese patients after their delivery?
There's no specific guideline, but there are data to indicate that they have an increased length of stay, again, probably because they're more likely to have complications, especially if they end up having a cesarean rather than a vaginal delivery. So we don't have a certain rule, but you can expect that they'll have an increased length of stay.
What are you looking forward to for the rest of the conference?
Well, I'm looking forward to debating Dr. Bob Geiser later today about a clinical topic. He's a formidable foe. He's a really good speaker. I'm looking forward to the rest of Elliot Main's lectures. We were so lucky to be able to entice him here.
Congratulations on such a successful conference. It was wonderful to talk to you. If you'd like to hear more of Dr. Barbara Scavone's talks, please look them up online. With the Stanford AIM Lab, my name is Lynn Ngai, signing off.